Hello, welcome back to the channel. Today I'm going to cover the process that I use to develop a bio-individualized GSRP program. Now, if we look back at 2003, the book that I wrote, there was an assessment form in there that I used to do before and after comparisons for people going through the program. Back then, I was calling it the JPD method of bodyworks. Video number 2 goes through all of that, so you can find out more about that in video 2, history. But for today, I'm going to cover the process of what I now call the Functional Orthopaedic Assessment. So as I said, I had developed a protocol for doing assessments before and after my program back in 2003, but after going to college for osteopathy and learning much more about the neuromuscular reflex arc, I then refined it considerably. So now I call it the Functional Orthopaedic Assessment. When I do that process, I take a videotape of the person doing some basic movements, forward bending and side bending. Essentially, that's pretty much all we do in the 4 different positions, front, side, back, side, as well as I do a balance test. From that, I then assess the levels of tissue contracture and dysfunction. From there, I develop a program to balance out those tissues. And at this junction in time, I don't really care if the shortened tissues or muscles or if it's fascia or if there's something wrong with the ligaments. That doesn't even matter, because the reality is when there's long-term joint dysfunction, either from injury or a repetitive strain injury, meaning that you're consistently using certain muscle groups in one way but their antagonists are never involved or very little involved, these repetitive patterns will eventually lead to soft tissue changes. And they will apply to every level of your being, from the skin right down to the joint. So, including the fascia and the muscle and everything that's on that same reflex arc. So let's look at, first, take a little peek at what I did in 2003, and after that, at what I'm doing nowadays for the online clients that I work with, as well as the people that come to me in 3D. Okay, let's go. So back then, I started with a static assessment in the coronal, sagittal, and transverse planes, looking for deviations from the plumb line going through the midline of the body. I then followed it with a dynamic assessment, looking at the range of motion of the spine and extremities in all 3 planes of motion. And finally, I did a pain or discomfort assessment, asking the client what increases the pain and what alleviates it. This information was recorded on these 2 charts. Static, and then the second page, dynamic. So that's how I did my assessments back in 2003. But after 4 years of osteopathic education and 13 years of osteopathic practice, I refined that assessment process considerably. And so that's why I now call it a functional orthopedic assessment. I take a video, I mark up the video so I show exactly what I'm seeing and what I'm going to be working on, and then I send a copy of that with the exercise plan to the client. The individualized exercise plan that I developed based on that assessment will include strength training for the underutilized muscles, which will allow the overworked muscles to lengthen and decrease in tension. But they also include breath-assisted positional releases to change the soft tissue that may have become contracted or even contractured over the years, and a breath-assisted activation to wake up those dormant muscles that are just going along for the ride and not doing much for your posture. Let's check it out. The Functional Orthopedic Assessment also includes a static assessment and a dynamic assessment. I watch as the client goes through every motion, front, side, back, side. I also observe the range of motion of the extremities, and I mark everything that I notice on the video at exactly the time point that I notice these things. This helps me to then determine which segments of the spine have lost some of their range of motion in any of the 3 planes, coronal, sagittal, or transverse. And then I put together a functional training program that is usually focused on just using your body weight, combined with some breath-assisted positional releases to soften the rigid joints that have lost certain ranges of motion, and some breath-assisted activation techniques in case you have some joint dysfunction that is also leading to muscle pain. Help to wake up those underutilized muscles. And finally, a balance test is also important to see if you're right or left dominant, and most people are dominant on one or the other leg. You'll also notice that on the static assessments, there's red points. Those indicate areas where the client is exhibiting extreme or significant pain that is limiting their ability to function normally in their day-to-day lives. We reassess every 3 months or so with a video, and that way the client can see how they're progressing on their health and wellness journey using exercise to restore balance and function to their entire body. As the muscular system becomes more balanced, the muscles then pull the joints into a much better alignment. This restores range of motion in both the spine as well as extremities, releasing all restricted areas and helping to decrease pain considerably, thus establishing an overall sense of well-being.